Imagine waking up in the middle of the night, gasping for air, feeling like you're drowning, but without being in water, or noticing that your legs are swollen, your heart is racing, and your energy is fading day by day. You might think it's just stress or aging, but what if I told you these signs could be a silent warning that your heart is in danger? Many people ignore symptoms like extreme fatigue, shortness of breath, or dizziness, not realizing they could be on the verge of a serious heart condition. Unfortunately, these warning signs are often dismissed until it's too late, and the consequences can be fatal. You could be at risk without even knowing it. But here's the good news. Your body is trying to warn you, and understanding these signals could be the key to preventing a major health crisis. Today, we're uncovering the 10 symptoms that indicate your heart might be failing, and how to recognize the danger before it's too late. Pay close attention until the end, because there's one symptom that almost no one associates with heart disease. Yet it could be the final warning before a heart attack. If you've ever felt unexplained fatigue or noticed changes in your breathing, this video could save your life. Your heart is working for you every second of the day. The real question is, are you listening to the warnings it's trying to give you? Stay with me until the end, because what you learn today could be the key to protecting your health and the health of those you love. Breathlessness is often dismissed as a minor inconvenience, perhaps a sign of aging, or just a momentary lapse in stamina. But what if I told you that this seemingly innocent symptom could be your heart's way of sending a distress signal? Medically known as dyspnea, shortness of breath can be one of the earliest indicators of heart failure, a condition in which the heart struggles to pump blood efficiently. When this occurs, fluid can accumulate in the lungs, making it increasingly difficult to breathe. This is not just a fleeting sensation of being out of breath after exertion. Many individuals with heart failure experience difficulty breathing even during minimal activity, or worse, at rest. One of the telltale signs is orthopnea, the worsening of breathlessness when lying down. Have you ever noticed that you need to prop yourself up on multiple pillows at night just to breathe more easily? That's because in a reclining position, fluid redistributes and exerts more pressure on the lungs, making it harder for oxygen to flow freely. In more severe cases, some people wake abruptly in the middle of the night, gasping for air, a phenomenon known as paroxysmal nocturnal dyspnea. The connection between shortness of breath and heart disease becomes even more evident when other symptoms accompany it. Swelling in the legs and ankles, edema, is a common warning sign, as a failing heart struggles to circulate blood effectively, causing fluid to pool in the lower extremities. Chronic fatigue is another crucial red flag. If you find yourself exhausted even after a full night's sleep, it could indicate that your body isn't receiving enough oxygen-rich blood to sustain normal energy levels. Some patients even develop a persistent nighttime cough or wheezing, often misattributed to allergies or a lingering cold. But in reality, it stems from fluid buildup in the lungs. But why does this happen? The underlying mechanism is simple yet profound. When the heart weakens, it fails to maintain proper circulation, leading to increased pressure in the pulmonary blood vessels. This, in turn, causes fluid to leak into the tiny air sacs in the lungs, disrupting the oxygen exchange necessary for breathing. At the same time, oxygen delivery to muscles and organs diminishes, leaving the body in a constant state of fatigue and weakness. These are not just minor inconveniences. They are the body's way of signaling that the cardiovascular system is under immense strain. There are certain patterns in breathlessness that should never be ignored. If you frequently wake up gasping for air, experience an increasing need to sleep with your head elevated, or find yourself struggling to breathe even during simple activities, these could be warning signs of an underlying heart condition. Breathlessness, combined with chest pain, palpitations, or dizziness, can indicate a more severe cardiovascular issue, one that requires immediate medical attention. There's a simple at-home test that can help assess whether your breathlessness may be related to heart function. Try lying flat on your back with just one pillow. If you feel discomfort or a sense of suffocation, and find relief only when elevating your head and upper body, this could be a sign of fluid accumulation in the lungs due to heart failure. Such symptoms should never be ignored. If you experience persistent shortness of breath, particularly when it occurs at rest or during the night, it is critical to seek medical evaluation. Many individuals mistake these warning signs for minor respiratory issues, but only a proper clinical assessment, including imaging and cardiac function tests, can confirm whether the heart is at fault. And in emergency situations, such as sudden and severe breathlessness, accompanied by chest pain or dizziness, immediate medical attention is crucial, as this could indicate a heart attack or pulmonary embolism. Breathlessness is one of the most subtle yet significant indicators of cardiovascular disease. Recognizing it early can lead to timely intervention, potentially slowing or even reversing heart failure. Progression with proper management, lifestyle changes, medications, and careful monitoring can help maintain heart health. But it all starts with awareness. If your breathing feels different, don't dismiss it. Your heart might be trying to warn you before it's too late. But here's something even more alarming. Shortness of breath is just the beginning. There's another symptom that nearly half of all heart attack survivors experienced before their emergency, yet they ignored it. A sensation that many dismiss as heartburn or simple discomfort until it's too late. If you've ever felt a tightness, burning, or pressure in your chest that comes and goes, pay close attention. Up next, we'll uncover why chest pain isn't always what you think it is, and how recognizing it in time could save your life. Chest pain, known as angina, is one of the most critical warning signs of a potential heart attack. Yet time and time again, people dismiss it as mere discomfort, indigestion, or fatigue, often with tragic consequences. In fact, nearly half of those who suffer a heart attack ignored the symptoms beforehand. This is why recognizing the nature of chest pain and acting swiftly can mean the difference between life and death. Angina occurs when the heart is deprived of oxygen-rich blood due to narrowed or blocked coronary arteries. This restriction prevents the heart muscle from functioning properly, triggering pain, tightness, or a burning sensation in the chest. The discomfort isn't always localized. It can radiate to the shoulders, left arm, jaw, neck, or even the upper back. Some describe it as a crushing weight pressing down on the chest, while others feel an intense pressure that comes and goes. What's most alarming is that angina is often a precursor to something far more dangerous, a heart attack. There are different types of angina, each signaling varying degrees of severity. Stable angina is predictable, typically triggered by physical exertion or emotional stress, and tends to subside with rest or medication, such as nitroglycerin. However, unstable angina is an immediate red flag. Unlike its stable counterpart, it can occur even at rest, linger for extended periods, and fail to improve with medication. This form of angina is a medical emergency, indicating that a heart attack may be imminent. Then there is variant angina, also known as Prince-Metal's angina, which is caused by spasms in the coronary arteries rather than blockages. It often strikes at night or during periods of rest and can be just as dangerous if left unchecked. While angina itself does not cause permanent heart damage, it serves as a critical warning that the heart is struggling. The difference between angina and a heart attack lies in duration and intensity. Angina pain typically lasts for a few minutes and improves with rest or medication. A heart attack, on the other hand, occurs when blood flow is completely blocked, depriving the heart muscle of oxygen for long enough to cause irreversible damage. The pain from a heart attack is usually more intense, lasts longer than 15 minutes, and does not subside with rest or medication. Certain symptoms, when paired with chest pain, should set off immediate alarm bells. Cold sweats, dizziness, nausea, irregular heartbeats, and shortness of breath often accompany heart attacks, making the situation even more urgent. Some people experience a sudden sense of impending doom, an inexplicable anxiety that something is terribly wrong. Women in particular may have less typical symptoms, such as unusual fatigue, discomfort in the upper abdomen, or even back pain. Every second counts. When a heart attack occurs, time becomes a race against irreversible heart damage, or even death. The longer the blockage persists, the more heart muscle dies. This is why it is critical to seek emergency medical help immediately at the first signs of a heart attack. If you suspect you or someone near you is having one, do not wait. Call emergency services right away. While waiting for help, if there are no allergies or contraindications, chewing a 300 milligram aspirin can help thin the blood and reduce clot formation. But under no circumstances should the individual attempt to drive themselves to the hospital. More physical exertion could worsen the situation dramatically. Prevention, however, is the most powerful tool against angina and heart attacks. Maintaining a heart-healthy lifestyle, which includes a balanced diet, regular physical activity, and effective stress management, can significantly reduce the risk of coronary artery disease. Controlling underlying conditions such as high blood pressure, high cholesterol, and diabetes is equally crucial. Regular checkups with a cardiologist can detect early warning signs long before they become life-threatening. Chest pain should never be taken lightly. It is the body's most direct warning sign that the heart is in distress. Understanding its causes, recognizing the symptoms, and acting swiftly can be life-saving. If your heart is sending a warning, listen before it's too late. Chest pain is one of the most urgent warning signs your heart can give. But sometimes the danger doesn't come as pain at all. What if your heart was sending distress signals in a completely different way? One that's often ignored until it's too late. Imagine feeling your heart suddenly racing, skipping beats, or pounding irregularly. Is it just stress, or something far more serious? In the next section, we'll uncover why palpitations could be a silent warning of a dangerous heart rhythm, and what to do if your heart starts acting out of sync. There are few sensations as unsettling as feeling your heart race uncontrollably, flutter erratically, or suddenly skip a beat. Palpitations, the sensation of an abnormal heartbeat, can be completely harmless, but in some cases they may be a serious warning sign. If your heart ever feels like it's running a race on its own, it may be time to listen closely to what it's trying to tell you. Palpitations occur when you become aware of your own heartbeat, a sensation that can manifest as rapid, irregular, or forceful beats. Some people describe it as a pounding in the chest, a fluttering in the throat, or even as if the heart is briefly pausing before beating again. These episodes can happen during rest, physical activity, or even while sleeping. Often they pass quickly and are dismissed as anxiety, dehydration, or caffeine sensitivity. But when palpitations become frequent, persistent, or are accompanied by other symptoms, they may indicate a more serious cardiac arrhythmia, a condition in which the heart's electrical system malfunctions, leading to dangerous rhythm disturbances. There are many possible causes of palpitations, and they are not always heart-related. Non-cardiac triggers include excessive stress, anxiety, panic attacks, lack of sleep, caffeine, alcohol, nicotine, or dehydration. Hormonal fluctuations, such as those occurring during pregnancy or menopause, can also cause palpitations. Certain medications, particularly stimulants like decongestants, asthma inhalers, or weight loss pills, can artificially elevate the heart rate. In some cases, even low blood sugar or thyroid imbalances can lead to noticeable heart palpitations. However, cardiac causes of palpitations demand much greater attention. Conditions such as atrial fibrillation, AFib, supraventricular tachycardia, SVT, or ventricular arrhythmias can disrupt normal heart function and, in severe cases, lead to stroke or sudden cardiac arrest. Structural heart diseases, such as heart failure, valve disorders, or coronary artery disease, can also manifest as irregular heartbeats. For some, the risk is genetic. Inherited syndromes like long QT syndrome or Brugada syndrome may cause life-threatening arrhythmias even in seemingly healthy individuals. The real challenge is distinguishing between harmless palpitations and those that signal imminent danger. A good rule of thumb is, palpitations are far more concerning if they are accompanied by other symptoms. If you ever experience chest pain, shortness of breath, dizziness, fainting, or cold sweats, alongside irregular heartbeats, this could indicate a heart attack, a severe arrhythmia, or even impending cardiac arrest. These symptoms demand immediate medical attention. Do not wait. Call emergency services right away. If you frequently experience palpitations, you can conduct a simple test at home to assess your heart rhythm. Place 2 fingers on the inside of your wrist and count your pulse for 30 seconds. Then multiply by 2 to determine your beats per minute, BPM. If you notice a high resting heart rate, above 100 BPM, frequent skipped beats, or an irregular rhythm, it is essential to seek medical evaluation. To diagnose the underlying cause of palpitations, a doctor may order an electrocardiogram, ECG, a Holter monitor test, which records heart activity for 24 hours or longer, or an echocardiogram to check for structural heart issues. Blood tests may also be necessary to rule out hormonal imbalances or electrolyte deficiencies. If an arrhythmia is confirmed, treatment options may include lifestyle changes, such as reducing caffeine, managing stress and improving sleep, medications to regulate the heartbeat, or in severe cases, medical procedures like catheter ablation or implantable devices, such as pacemakers or defibrillators. While occasional palpitations may not be a cause for concern, frequent, prolonged, or symptomatic episodes should never be ignored. Heart rhythm disorders can often be managed effectively if caught early, preventing complications like stroke or heart failure. Your heart has a rhythm for a reason. If it's out of sync, don't wait for it to reset on its own. Seek answers before it's too late. Feeling your heart race unpredictably can be terrifying. But what if your body was showing another hidden warning sign, one that you might not even associate with your heart at all? Imagine looking down and noticing your ankles swollen, your shoes feeling tighter by the end of the day. Most people assume it's just normal fluid retention, but in reality, it could be your heart struggling to keep up. Up next, we'll reveal why swollen legs and feet could be a silent distress signal from your heart, and how to tell if it's time to seek medical help. Swelling in the lower limbs, known as edema, is often dismissed as a minor inconvenience, something that happens after standing for too long or as a natural part of aging. But what if I told you that persistent swelling could be a silent warning from your heart? In many cases, edema is the body's way of signaling that the heart is struggling to pump blood efficiently, potentially pointing to heart failure or other cardiovascular issues. Ignoring it could mean overlooking an early warning sign of a life-threatening condition. Edema occurs when excess fluid builds up in the body's tissues, most commonly in the feet, ankles, and lower legs. This fluid retention may seem harmless at first, but it is often the result of poor circulation. The heart, responsible for maintaining proper blood flow, relies on a delicate balance of pressure and efficiency. When the heart weakens or fails to pump blood effectively, the return of blood from the lower body to the heart slows down. This causes fluid to accumulate in the extremities, resulting in noticeable swelling, especially as the day progresses. While heart failure is one of the most concerning causes of edema, it is not the only possibility. Swelling in the lower limbs may also be linked to kidney or liver disease, varicose veins, deep vein thrombosis, DVT, or side effects from certain medications, including blood pressure drugs and corticosteroids. Hormonal imbalances, particularly those associated with pregnancy, menopause, or thyroid dysfunction, can also trigger fluid retention. However, when swelling occurs persistently and is accompanied by additional symptoms such as shortness of breath, rapid weight gain, or extreme fatigue, it strongly suggests that the underlying issue may be cardiac in nature. The warning signs of serious edema go beyond simple swelling. If your legs feel tight, shiny, or unusually firm, this could indicate that fluid is accumulating at a rate faster than the body can regulate. Another key indicator is pitting edema, where pressing a finger into the swollen area leaves a visible indentation that takes several seconds to disappear. This is a clear sign that fluid retention is significant and may require medical intervention. There is a simple test you can perform at home to assess whether your swelling is mild or potentially serious. Gently press your finger against your shin or ankle for about 5 seconds, then release. If a visible dent remains for more than a few seconds, your body may be holding on to excess fluid, which could indicate an underlying condition that needs medical attention. So, when should you seek medical help? If your swelling persists despite rest, worsens over time, or occurs unevenly, affecting only one leg, this could be a sign of deep vein thrombosis, DVT, a dangerous blood clot that requires urgent medical care. Likewise, if the swelling is accompanied by shortness of breath, chest pain, or unexplained exhaustion, it may be a sign of heart failure or another cardiovascular condition. In such cases, delaying a medical evaluation could put your health at serious risk. Diagnosing the cause of edema involves various medical tests, including echocardiograms, blood tests, and vascular ultrasounds. Treatment depends on the root cause. If the swelling is related to heart failure, diuretics, water pills, may be prescribed to reduce excess fluid, alongside medications to strengthen the heart's function. Lifestyle changes, such as reducing salt intake, staying physically active, and wearing compression socks, can also help manage the condition and improve circulation. Swelling in the lower limbs might seem harmless at first, but it is often a silent alarm for deeper health issues. Recognizing the difference between occasional fluid retention and a symptom of something far more serious can be life-saving. Your body speaks to you in many ways. Don't ignore what it's trying to tell you. Swollen legs and feet might seem like a minor inconvenience, but as you just learned, they can be a critical warning sign of heart trouble. But what if the fatigue and heaviness weren't just in your legs, but in your entire body? Imagine feeling drained all the time, struggling to get through simple daily tasks, and waking up exhausted, even after a full night's sleep. Could this relentless fatigue be another hidden symptom of heart disease? Up next, we'll reveal why constant exhaustion might not just be a sign of aging, but your heart waving a desperate red flag. Fatigue is often brushed aside, blamed on stress, poor sleep, or the demands of daily life. But when exhaustion lingers even after a full night's rest or minimal physical effort, it may be your heart trying to send an urgent message. Many people don't realize that persistent, unexplained fatigue is one of the earliest warning signs of heart failure. It signals that the heart is struggling to keep up with the body's needs and, if ignored, could lead to far more serious complications. But why does heart-related fatigue happen? The answer lies in circulation. A healthy heart ensures that oxygen-rich blood reaches every part of the body efficiently. But when the heart weakens, whether due to heart failure, coronary artery disease, or other cardiovascular conditions, its ability to pump blood effectively declines. To compensate, the body redirects blood to prioritize vital organs such as the brain and lungs, leaving the muscles, limbs, and peripheral tissues deprived of oxygen and nutrients. The result? A constant crushing sense of exhaustion, even after minor activities like walking or climbing a flight of stairs. Beyond the lack of oxygen delivery, a failing heart can also lead to toxin buildup in the body. When circulation slows, the kidneys struggle to filter waste efficiently, leading to an accumulation of metabolic byproducts in the bloodstream. This toxic overload can further worsen fatigue, making even simple daily tasks feel overwhelming. Unlike ordinary tiredness, heart-related fatigue is often accompanied by additional warning signs. Shortness of breath, especially during routine activities or while lying down, can indicate fluid buildup in the lungs, a hallmark of heart failure. Swelling in the feet and ankles, edema, may also appear as the body struggles to eliminate excess fluid due to poor circulation. Heart palpitations or irregular heartbeats might become noticeable, suggesting that the heart is working harder than usual to compensate for its inefficiency. Some people even experience dizziness or near-fainting episodes. particularly when standing up quickly, due to reduced blood flow to the brain. One of the biggest dangers of cardiac fatigue is that it often goes unnoticed or misattributed to other, less serious causes. It's common for individuals to assume that their exhaustion is due to stress, anxiety, or poor sleep habits. Some may suspect nutritional deficiencies, such as low iron or vitamin B12 levels, and while these can contribute to fatigue, they do not explain the deep, persistent exhaustion caused by an overworked heart. When fatigue becomes chronic, unexplained, and progressively worse, it is crucial to consider the possibility of an underlying cardiovascular issue. So when should you seek medical attention? If your fatigue is interfering with your daily life, making it difficult to complete routine activities, forcing you to rest excessively, or worsening over time, it's time to consult a doctor. Pay close attention if fatigue is accompanied by shortness of breath, swelling in the legs, chest discomfort, or heart palpitations. These symptoms suggest that the heart is struggling to function properly and may require immediate evaluation. To determine whether fatigue is heart-related, doctors may order a series of diagnostic tests. An electrocardiogram, ECG, can detect irregular heart rhythms, while an echocardiogram can assess the heart's pumping efficiency and check for structural abnormalities. Blood tests can help identify underlying deficiencies, as well as markers of heart stress, such as brain natriuretic peptide, BNP, which is elevated in heart failure. Treatment for cardiac fatigue depends on the underlying cause. If heart failure or another cardiovascular condition is diagnosed, medications such as beta blockers, ACE inhibitors, or diuretics may be prescribed to help improve heart function and fluid balance. Lifestyle changes, including a heart-healthy diet, controlled physical activity, and weight management, play a crucial role in reducing stress on the heart. Managing conditions such as high blood pressure and diabetes is also essential to preventing further cardiac deterioration. Fatigue should never be ignored, especially when it feels disproportionate to your level of activity. It is often one of the first signs that the heart is struggling, and catching it early can make a significant difference in preventing complications and improving long-term heart health. If your energy levels feel depleted without explanation, your heart may be calling for help. Listen before it's too late. Feeling exhausted all the time isn't just frustrating. It could be a serious red flag that your heart is in trouble. But what if your dizziness and fatigue weren't just signs of being tired, but actually a dangerous drop in blood flow to your brain? Imagine standing up and suddenly feeling lightheaded, woozy, or even blacking out for a moment. Many people shrug it off, but this could indicate a heart condition that affects circulation and puts you at risk for sudden falls or even stroke. Up next, we'll uncover why dizziness and fainting spells might be one of the most overlooked warning signs of heart disease, and when they become a medical emergency. Have you ever felt a sudden wave of dizziness upon standing up or experienced a brief blackout, only to regain consciousness moments later? What if I told you that fainting could be your body's way of warning you about an impending cardiac event? While occasional dizziness may seem harmless, frequent or unexplained episodes could be an early sign of serious heart conditions, including arrhythmias, valve disease, or even heart failure. Dizziness and fainting, medically known as syncope, occur when there is a temporary drop in blood flow to the brain. The heart, responsible for maintaining steady circulation, can sometimes fail to deliver an adequate supply of oxygen-rich blood, resulting in a brief loss of consciousness. This can be triggered by a sudden drop in blood pressure, an irregular heartbeat, or structural problems within the heart itself. In some cases, these symptoms may be the first indication of an undiagnosed cardiovascular condition, one that, if left untreated, could escalate into a life-threatening event. One of the most common heart-related causes of dizziness and fainting is arrhythmia, a condition where the heart beats too fast, too slow, or irregularly. When the heart rhythm becomes unstable, blood circulation can be disrupted, depriving the brain of oxygen momentarily and leading to fainting spells. Atrial fibrillation, AFib, ventricular tachycardia, or bradycardia, a dangerously slow heart rate, are some of the most concerning arrhythmias that can trigger syncope and, in severe cases, cardiac arrest. If dizziness is sudden, persistent, or accompanied by palpitations, it may signal an underlying heart rhythm disorder that requires urgent medical attention. Another silent culprit behind unexplained fainting is valvular heart disease. Conditions like aortic stenosis, where the heart's aortic valve narrows, restricting blood flow, can make it difficult for the heart to push enough oxygenated blood to the brain. Many patients with severe aortic stenosis experience dizziness upon exertion, sometimes leading to collapse. Without timely intervention, this condition can progress rapidly, increasing the risk of heart failure or sudden cardiac death. Hypotension, or low blood pressure, is another major contributor to dizziness. Some individuals experience orthostatic hypotension, a condition where blood pressure drops significantly upon standing. This sudden decline in circulation can lead to lightheadedness or fainting, particularly in older adults or those on certain medications. While it may seem like a minor inconvenience, chronic hypotension could be an indication of underlying cardiovascular insufficiency and should never be ignored. One of the most dangerous aspects of dizziness and fainting is how easily they are dismissed. Many people attribute these symptoms to simple dehydration, standing up too quickly, or even stress, when, in reality, their heart could be struggling to maintain proper circulation. If you frequently feel dizzy while walking, standing, or performing routine activities, it's essential to get evaluated by a cardiologist. These symptoms are not normal and should never be overlooked. A critical warning sign to watch for is syncope that occurs without warning. If you faint suddenly, with no preceding dizziness or lightheadedness, this could indicate a severe cardiac arrhythmia, one that may lead to sudden cardiac arrest. Likewise, if dizziness or fainting is accompanied by chest pain, palpitations, shortness of breath, or blurred vision, it could signal an urgent cardiovascular emergency. In such cases, immediate medical attention is crucial. Diagnosing the cause of dizziness and fainting often requires a combination of cardiac tests, including an electrocardiogram, ECG, to assess heart rhythm, an echocardiogram to evaluate valve function, and a Holter monitor to track irregular heartbeats over time. Blood pressure measurements in different positions, lying, sitting, and standing, can help determine if orthostatic hypotension is present. In some cases, a tilt table test may be performed to observe how blood pressure and heart rate respond to changes in posture. Treatment for dizziness and fainting depends entirely on the underlying cause. If arrhythmia is detected, medications, pacemakers, or even defibrillators may be needed to stabilize the heart's rhythm. For valvular disease, surgical interventions such as valve repair or replacement may be necessary to restore normal blood flow. Lifestyle modifications, such as staying hydrated, avoiding sudden posture changes, and managing blood pressure carefully, can help mitigate symptoms, but they should never replace proper medical treatment. Dizziness and fainting are not random occurrences. They are symptoms that demand investigation. When they are linked to heart disease, they can be the first signs of something far more serious. If you have been experiencing frequent dizziness, blackouts, or lightheadedness, don't ignore them. Your heart might be trying to warn you before it's too late. Feeling dizzy or fainting might seem like a minor inconvenience, but as you've just seen, it can be a serious warning that your heart isn't pumping blood efficiently. But what if your body had another, even more unexpected way of telling you that your circulation is failing? Imagine developing a stubborn, nagging cough or a wheezing sound when you breathe. You might think it's just allergies or a lingering cold, but in reality, it could be your lungs filling with fluid due to heart failure. Up next, we'll uncover why a persistent cough could be a hidden symptom of a struggling heart, and what signs mean it's time to take action before it's too late. A lingering cough is often dismissed as a minor annoyance, perhaps a lingering cold, seasonal allergies, or even just a dry throat. But what if your persistent cough wasn't coming from your lungs, but from your heart? Many people are unaware that a chronic, unexplained cough can be a warning sign of heart failure, or caused by the accumulation of fluid in the lungs due to the heart's inability to pump blood efficiently. This condition, known as pulmonary edema, can lead to symptoms that mimic respiratory illnesses, but have a far more serious underlying cause. Unlike the coughs caused by infections, asthma, or allergies, a cardiac cough follows a distinct pattern. It is often worse when lying down, leading some individuals to prop themselves up on multiple pillows at night just to breathe more comfortably. It can be dry or produce frothy, pink-tinged mucus, which indicates the presence of blood in the fluid accumulating in the lungs. In many cases, shortness of breath, wheezing, and a feeling of tightness in the chest accompany the cough, further pointing to heart-related congestion rather than a simple respiratory issue. This occurs because a failing heart struggles to circulate blood efficiently, causing pressure to build in the pulmonary vein, which in turn forces fluid into the lung tissue, triggering persistent coughing. Many people don't associate coughing with heart disease, leading them to delay seeking medical attention. Instead, they may turn to cough syrups, allergy medications, or antibiotics, mistakenly believing they are dealing with a respiratory infection. This delay can be dangerous, as early recognition of a cardiac cough can be crucial in diagnosing heart failure before it worsens. So, how can you tell if your cough is heart-related rather than due to an infection or allergies? Pay attention to the triggers. If your cough worsens at night or after physical exertion, is accompanied by swelling in the legs or ankles, edema, persistent fatigue, or breathlessness, it is not just a common cough, it is a distress signal from your heart. Wheezing or a gurgling sound when breathing may also suggest fluid buildup in the lungs, further supporting a cardiac cause. A persistent, unexplained cough, especially one that occurs alongside other symptoms of heart failure, should never be ignored. If you or someone you know experiences a cough that does not improve with traditional treatments and is accompanied by breathing difficulties, swelling, or fatigue, it's critical to seek medical evaluation immediately. Doctors may perform tests such as a chest X-ray or echocardiogram to assess fluid accumulation in the lungs and heart function. Blood tests can also detect biomarkers associated with heart failure, while electrocardiograms, ECG, and stress tests help determine how well the heart is pumping blood. Treatment depends on the severity of heart failure but often involves diuretics to help remove excess fluid, medications to improve heart function, and lifestyle modifications to reduce strain on the cardiovascular system. Identifying and treating the cause early can significantly improve quality of life and prevent life-threatening complications. A chronic cough is not always just a cough. Sometimes it is one of the earliest signs of a failing heart. If your cough has been persistent and does not respond to usual treatments, don't ignore it. Your heart might be struggling, and the sooner you act, the better your chances of preventing serious complications. A lingering cough might seem harmless, but as you now know, it could be a critical warning that your heart is struggling. However, what if your heart wasn't just affecting your lungs, but also your mind? Imagine feeling unusually forgetful, struggling to focus, or experiencing sudden mental fog. Many people assume it's just aging, stress, or even early dementia. But in reality, it could be your brain being starved of oxygen due to poor circulation. Up next, we'll reveal how memory problems, confusion, and difficulty concentrating could be hidden signs of heart disease, and what you need to know before it's too late. Have you ever found yourself struggling to focus, forgetting simple things, or feeling unusually drowsy during the day? What if I told you that your heart, not just your brain, could be the reason behind these symptoms? Many people attribute mental fog, memory lapses, and excessive daytime sleepiness to stress, aging, or poor sleep. But these could actually be warning signs of an underlying heart condition. The connection between the heart and the brain is far stronger than most realize. The brain depends on a steady supply of oxygen-rich blood, and when the heart fails to pump efficiently, cognitive function can suffer. Heart failure, arrhythmias, and even silent heart attacks can reduce blood flow to the brain, leading to episodes of confusion, slower thinking, impaired decision-making, and difficulty concentrating. Over time, these changes can become more pronounced, mimicking conditions like dementia, but with one key difference. When the heart is treated, cognitive function can often improve. Recent studies have shown that chronic cardiovascular disease can cause structural damage to the brain, reducing the density of gray matter in critical areas such as the hippocampus, responsible for memory, and the frontal cortex, responsible for reasoning and problem-solving. These brain changes aren't just theoretical. They're measurable on brain scans of individuals with long-term heart disease. Moreover, poor circulation can weaken the blood-brain barrier, allowing inflammatory molecules to enter the brain, potentially accelerating cognitive decline and neurodegeneration. This condition is sometimes referred to as cardiogenic dementia, a term used to describe cognitive impairment directly linked to chronic heart disease. Unlike Alzheimer's or other primary neurodegenerative diseases, cognitive issues caused by heart disease can often be reversed or improved with proper cardiovascular treatment. This is one of the most compelling reasons why symptoms like forgetfulness, decision-making struggles, or persistent brain fog should never be ignored, especially if they occur alongside other signs of heart disease, such as shortness of breath, fatigue, or swelling in the legs. The key to distinguishing heart-related cognitive issues from normal aging lies in their pattern. If memory lapses or confusion seem to fluctuate, worsening during moments of fatigue or when standing up too quickly, this could indicate a circulatory issue rather than a purely neurological condition. Patients with irregular heart rhythms, such as atrial fibrillation, are particularly at risk, as AFib can lead to tiny, unnoticed strokes that slowly degrade brain function over time. When should you seek medical help? If you frequently feel mentally sluggish, forgetful, or have difficulty processing information, don't assume it's just age catching up to you. If these symptoms occur alongside dizziness, palpitations, chest discomfort, or unexplained fatigue, it's time to investigate your heart health. Early diagnosis can make a tremendous difference, not just for your heart, but for your long-term brain function as well. Doctors can assess whether your cognitive symptoms are heart-related through a combination of cardiac and neurological tests. Echocardiograms, EKGs, and blood flow studies can determine if poor circulation is affecting brain function, while cognitive assessments can establish a baseline for memory and reasoning abilities. Treatment focuses on optimizing heart health, which often results in improved mental clarity, sharper focus, and better overall cognitive performance. The most important takeaway? Brain fog, forgetfulness, and decision-making struggles are not just part of aging. They could be your heart's way of telling you that it needs help. Addressing the issue early can prevent long-term cognitive decline and even reduce the risk of stroke or dementia. If your mind feels clouded, don't ignore the signs. Your heart and brain are more connected than you think. Mental fog and forgetfulness might seem like a normal part of aging, but as you now know, they could be your heart struggling to pump enough oxygen to your brain. But what if your body had one final, dramatic way of showing you that something was seriously wrong? Imagine looking in the mirror and noticing your lips, fingers, or even toes turning bluish. It might seem like a simple circulation issue or exposure to cold, but in reality, it could be a sign that your blood isn't carrying enough oxygen, putting your heart and lungs in immediate danger. Up next, we'll uncover why skin discoloration, especially a bluish tint, can be one of the most urgent warning signs of heart disease and when it signals a medical emergency. Have you noticed rapid weight gain without any changes in your diet or activity level? What if I told you that this could be a sign that your heart is struggling? Many people assume that weight fluctuations are simply due to eating habits. But when weight increases suddenly, sometimes by several pounds in just a few days, This could be a red flag for heart failure. Unlike gradual weight gain caused by fat accumulation, cardiac-related weight gain is due to fluid retention. When the heart weakens and struggles to pump blood efficiently, the kidneys respond by holding on to sodium and water, causing fluid buildup in tissues. This leads to noticeable swelling, edema, in the legs, ankles, feet, or abdomen, and an overall feeling of bloating or heaviness. Many people don't connect these symptoms to their heart, but the rapid onset of swelling and weight gain can indicate that the cardiovascular system is in distress. How can you tell if your weight gain is due to fluid retention rather than other causes? One of the most telling signs is a sudden increase of more than 2 kilometers, 4 to 5 lbs, in just a day or two, without any significant changes in diet or activity. This type of weight gain is often accompanied by a sensation of tightness in clothing or shoes, even if you haven't been eating more than usual. Some people also experience shortness of breath or extreme fatigue, as excess fluid puts pressure on the lungs and makes it harder for the heart to function properly. The danger of ignoring rapid weight gain is that it could be a sign of decompensated heart failure, a state in which the heart is no longer able to meet the body's demands. This means the condition is worsening, and without urgent medical intervention, serious complications such as fluid overload, lung congestion, and organ damage can occur. If fluid buildup continues unchecked, it can even lead to pulmonary edema, where the lungs fill with fluid, making breathing increasingly difficult. One of the most effective ways to catch this early is by monitoring your weight daily. Weigh yourself at the same time each morning, preferably after using the bathroom and before eating. If you notice a sudden spike in weight, especially if it's paired with swelling, shortness of breath, or extreme fatigue, seek medical attention immediately. Heart failure can be managed effectively if detected early, but delaying treatment can lead to dangerous complications. Doctors can confirm whether fluid retention is heart-related through tests like an echocardiogram, chest X-ray, or blood tests that measure heart stress markers such as BNP, brain natriuretic peptide. If heart failure is diagnosed, treatment may include diuretics to help remove excess fluid, medications to improve heart function, and lifestyle adjustments to reduce sodium intake and manage fluid balance. Many people assume that weight gain is only about calories, but when it happens suddenly and without explanation, it could be a life-saving clue that your heart is struggling. If your weight jumps within a matter of days and is accompanied by swelling or breathing difficulties, don't ignore it. Your body is sending a critical warning. Taking action early can prevent complications, improve heart function, and ultimately, save your life. Struggling to think clearly, forgetting simple things, or feeling mentally drained could be your brain's way of signaling that your heart isn't working as it should. But what if your body had another, more visible warning sign? One that you could notice just by looking in the mirror. Imagine waking up one day and noticing that your lips, fingertips, or even toes have taken on a strange bluish tint. Most people wouldn't think much of it, but in reality, this could mean that your blood isn't getting enough oxygen, a dangerous sign that your heart or lungs are in trouble. Up next, we'll uncover why skin discoloration, especially a bluish hue, could be a serious signal of circulatory failure and what it means for your heart health. Have you ever noticed a bluish or purplish tint on your lips, fingertips, or nails? What if I told you that this could be a life-threatening sign that your body isn't getting enough oxygen? Known as cyanosis, this discoloration is not merely a cosmetic change. It is a critical warning that your heart, lungs, or circulatory system may be failing to deliver oxygen where it's needed most. Cyanosis occurs when oxygen levels in the blood drop to dangerously low levels. Under normal circumstances, oxygen-rich blood is bright red, giving the skin a healthy, warm tone. But when oxygen supply becomes insufficient, blood takes on a darker bluish hue, causing the visible discoloration that is often first noticed on the lips, tongue, mucous membranes, hands, and feet. This can happen for a variety of reasons, but in many cases, It signals a serious underlying condition that requires immediate medical attention. There are two primary types of cyanosis, each pointing to a different underlying problem. Central cyanosis affects the lips, tongue, and mucous membranes, and is typically caused by severe heart or lung disease. This includes conditions like heart failure, congenital heart defects, such as tetralogy of Fallot, or severe respiratory issues like pneumonia, pulmonary embolism, or advanced chronic obstructive pulmonary disease, COPD. On the other hand, peripheral cyanosis is more localized, appearing in the fingers, toes, or extremities. It is often caused by poor circulation due to vascular diseases, exposure to extreme cold, or conditions that cause blood vessel constriction. The presence of cyanosis is never normal and is frequently linked to serious, potentially fatal conditions. For example, congenital heart defects can cause improper mixing of oxygenated and deoxygenated blood, leading to low oxygen levels from birth. Heart failure can impair the heart's ability to pump oxygen-rich blood effectively, resulting in cyanosis as a late-stage symptom. Lung diseases such as severe asthma, pneumonia, or pulmonary embolism can drastically reduce the lung's ability to oxygenate the blood. Even conditions like severe sleep apnea or high-altitude exposure can trigger episodes of low blood oxygen, hypoxemia, leading to cyanosis. But why is cyanosis so dangerous? The longer the body is deprived of oxygen, the higher the risk of irreversible organ damage. If left untreated, cyanosis can lead to brain damage, heart failure, respiratory collapse, and even sudden death. In severe cases, cyanosis may indicate that cardiac or respiratory arrest is imminent. The urgency of intervention cannot be overstated. Patients with cyanosis are at an 80% higher risk of fatal complications if not treated promptly. Recognizing early warning signs of cyanosis is crucial. This condition is most noticeable in areas with thin skin, like the lips, nails, and earlobes. In individuals with darker skin tones, it may be more apparent in the tongue, gums, or under the fingernails. Other symptoms that often accompany cyanosis include shortness of breath, dizziness, confusion, extreme fatigue, and chest pain. These warning signs should never be ignored. They indicate that oxygen levels are dangerously low and immediate medical attention is required. So, what should you do if you or someone you know exhibit signs of cyanosis? Seek emergency medical help immediately. The first step in treatment is identifying and addressing the underlying cause. Medical interventions may include oxygen therapy to restore oxygen levels, medications to treat heart failure or pulmonary conditions, or surgical procedures in cases involving congenital heart defects. Acting quickly can prevent serious complications and save lives. Cyanosis is not just a symptom. It is a desperate signal from the body that oxygen is running dangerously low. If you ever notice a blue tint on the lips, fingers, or nails, especially if it is accompanied by difficulty breathing, extreme fatigue, or confusion, do not wait. Your body is sending you a life or death warning. Listen to it before it's too late. From shortness of breath to chest pain, from persistent fatigue to bluish skin, your body has many ways of warning you that your heart is in trouble. The real danger? Ignoring the signs until it's too late. Now that you know these 10 warning signs, the next step is crucial. Take action. If you or a loved one are experiencing any of these symptoms, don't wait. Seek medical attention and start prioritizing your heart health today. Your heart is working for you every second of every day. The question is, are you listening to what it's trying to tell you? If this video helped you, leave a comment, share it with someone who needs to hear this, and subscribe for more life-saving health insights. Wait a moment. Don't leave the video just yet. If you've made it this far, it means you truly care about your health. And now comes an even more crucial piece of information. Knowing the warning signs your heart may be sending is essential. But what if I told you that there are silent enemies in your daily life that could be putting your health at even greater risk? Some foods, which seem harmless, might actually be overloading your heart. raising your blood pressure, and accelerating the aging of your arteries without you even realizing it. The truth is that many of these foods contain dangerously high levels of sodium, unhealthy fats, and chemical additives that inflame your blood vessels, impair circulation, and force your heart to work overtime. Others cause uncontrolled spikes in blood sugar, triggering a dangerous cycle that can lead to diabetes, obesity, and even heart failure. The worst part? Many of these harmful ingredients are found in everyday foods that people consume regularly, unaware of the devastating impact they may be having on their bodies. And the damage doesn't stop there. Certain oils, artificial sweeteners, and even processed meats contain toxins that, over time, significantly increase the risk of cancer, degenerative diseases, and even impair memory and cognitive function. When you combine these foods with the heart warning signs we've discussed so far, the risk becomes even greater. And that's exactly why you need to know which foods are silently damaging your health before it's too late. The good news is that you can protect yourself, and the next video will reveal exactly which 10 foods are slowly killing seniors without them even realizing it. These are common foods, ones that many people have in their fridge right now, but they could be causing irreversible damage to your health. Click on the video that's appearing on your screen now and find out what might be sabotaging your well-being without you even knowing it. Your heart and your future will thank you.